moving on, I'm honored to welcome you all to the second session of the day on the topic Enhancing Women Mental Health, the Balance Between Work and Family Life. Before moving on to the session, let me introduce to you all our speaker for the session, Dr. Seema P Uthaman, currently working as Head Department of Psychiatric Social Work IMHANS, Kozhikode. Dr. Seema has completed psychiatric social work from National Institute of Mental Health and Neurosciences. She has also won the Best Teacher Award in Allied Health Sciences under Kerala University of Health Sciences. It's indeed our pleasure to have you here, ma'am. I, on behalf of IEEE MSS, cordially welcome you to this session.
Thank you. Are there any other formalities, or I can start sharing the screen?
You can.
Thank you. Is that visible?
Yes, ma'am.
Okay. Warm good evening to one and all. I'm very happy to be sharing today's evening with all of you. I am here to discuss about enhancing women mental health, the balance between work and family life. May I know how many of you are working or how many of you are students? A rough number out of the 30 participants.
I think almost 70% are students.
Okay. So let me begin with a simple question to you. How are you today? From a scale from 1 to 5, could you please rate yourself where you stand emotionally, or the quality of your life, where it stands, and keep it with you. I don't want you to share it in this public platform, but see, where 1 is I'm doing great, 2, I'm doing okay, but not that great, 3, I'm getting really irritated, 4, I'm getting too angry, and 5, I can't stand this and ready to explode. You can connect this with your today's mood, or for the past 1 week, how you have been feeling. So people who are at 1 saying I'm doing great may not help from this session, but people who are at 3, 4, and 5 will definitely have something to think about in your upcoming days. Hope all of you have rated yourself according to the scale. Okay, so this is a term which you might have heard quite a number of times. Mental health. What is your understanding of mental health? Maybe slightly different from what as a professional I feel. So today I'm discussing about the WHO definition of mental health, that is considered as a state of well-being in which the individual realizes his or her abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to his or her community. So it's considered as a state of well-being. Hope all of you feel that well-being within yourself, and you should be able to realize your own potentials or your own abilities, and should be able to cope with normal stresses of life, Everybody has some or the other stress. So if you're able to manage those normal stresses of life and can work productively and fruitfully and is able to make contribution to the community, if you fulfills all these criteria, you can claim that you are a person who is mentally healthy. And if somebody is not able to say that I'm mentally healthy, you need not get worried. There are ways through which you can enhance your mental health. So today's session, I hope I'm addressing all women folk. So what are the specialities of being a woman? Compared to the opposite gender, women are capable of multitasking. You can just see the image, or you can just think about yourself, or students can think about your mother or other family members who are females. We are blessed with the capacity to multitask. Means you are able to do multiple tasks at a given point of time. You are sitting in this session. You may be noting down some of the points. You may be messaging or texting somebody else. And you are planning how to spend your evening. So a lot more can be done by women. And the other speciality is we are very caring and concerned about others. Do you agree with me? I hope I can hear one or two voices in between, because it's quite boring otherwise to have a one-way lecture. You can unmute yourself and feel free to talk. Questions only we can keep to the end of the session. Are you caring and concerned about others? Please respond. I would like to hear the students responding. Do you consider this as a quality in you? Should I wait or hold on my session till I hear a voice from the participants? Other than the coordinators, any of the participants, I just want to make sure that you people are there and you are alert, not sleeping. So please.
Yes, ma'am.
I expected a female voice and I'm hearing a different one.
Yes,
Thank you for that. Thank you. Thank you.
Yes,
Okay.
ma'am.
Okay. So another speciality is, compared to men, women have good memory. If you think about the date of birth of your partner or a friend or a special date of your siblings, you will be able to recall. But men are very poor at remembering things, especially the dates, the festivals, or the family functions and the related stuff. I'm talking the general perspective. There may be people who are extraordinarily skillful to remember things, males who are extraordinarily brilliant and remembering all the dates, and females who have poor memory. But this is the general picture. And women are highly emotional. What does that mean now? Being highly emotional. It can be interpreted in other way that we are soft at heart. That doesn't mean that we will bend or melt in every situation, but we have some of this soft emotions, like little more of sadness, little more of anxiety, and a little more of what? Anger. Okay, so these are the specialities of women. And now, are women more vulnerable compared to men in terms of the mental health? So studies have shown that mental disorders can affect women and men differently. And some disorders are more common in women, such as depression and anxiety. If you take the prevalence rates of depression and anxiety, women outnumber men. And there are also certain types of disorders that are unique to men, which will never happen in a unique to women, which may never happen in a man. So examples for the same are: some women may experience symptoms of mental disorders at time of hormonal change, such as perinatal depression, premenstrual dysphoric disorder, and premenopause related depression. These are mostly unique to women. And what are the common things we will see first? One is depression. So this is again a term which almost all of us are very familiar with, and we use this term very generously. If you feel low or if you feel sad, you yourself will tell that, oh, I'm not doing good, or I'm depressed. And you will tell your friends and colleagues also that I'm depressed. But is that the clinical feature of a depressive episode? No. To be having a diagnosis of depressive disorder, you should have this kind of sadness which is long lasting or pervasive. So it is one characteristic feature of a depressive disorder is pervasive sadness or low mood. Then crying spells in the sense you feel sad and you are teary most of the time. It may be a very small incident, but you don't know how you end up crying. So crying spells as another feature. Then decreased appetite. You don't feel like eating. And at times there are few people who say that when they are having low mood, they tend to eat a lot. And the other characteristic feature is difficulties in falling asleep, or even if you fall asleep, you have difficulty in continuing the sleep. Like in between, if you wake up, you find it very difficult to sleep again. Then easy fatigability, that means you feel very, very tired. With minimum work, a person who is in depression may feel exhausted. And next is inability to enjoy pleasurable activities like talking to your friends, watching a favorite program on TV, or reading some books. If these are the things which you used to enjoy on other days, and if you are not able to enjoy this at present, so that characterizes depression. And then you have pessimistic views about future, like nothing is going to change, is the pessimistic view of the future. People tend to feel hopeless, helpless, and worthless while they are undergoing a depressive episode. And all the symptoms we may be having in between. Right. If you have had a conflict with your partner or a loved one, you may be having all these kind of feelings. Or if you failed in your exams, or if you fail to submit a particular document on a given date, you may feel sad or depressed. But to clinically diagnose a person with a depressive disorder, these symptoms should be lasting for at least 2 consecutive weeks. So one day, if I felt very sad and I had all these features, it doesn't fulfill the criteria for a depressive disorder. If you are continuously having it for the last 2 weeks, then there is high possibility that you are undergoing a depressive episode. Hope that is clear for you. And the next commonly seen mental health condition is anxiety. This is again another term which we commonly use and say that I feel anxious. But what I'm saying is about an anxiety disorder or an anxiety episode where the worries are mostly without a cause. You don't know why you are worried, but You can't resist the worries within you. Then people who are anxious or having the anxiety disorder has the inability to relax. You can't stand still or you can't sit still. You feel like getting up when you are sitting. You feel like walking when you are standing, or when you are walking, you feel like sitting down. And you have this tendency to do different things at the same time. And none of these things will calm down yourself. Then people who are having anxiety disorder will have inability to concentrate. They may lack self-confidence. People report that they tend to have faster heart rates. Some people have tremors. And if it is an anxiety disorder, we have the tendency to avoid the anxiety-provoking situations. Before exams, most of the students will be feeling anxious, but that doesn't fulfill the criteria for an anxiety disorder, because here in anxiety disorder, we worry for no cause. But if you are going or appearing for an exam, you have a cause to connect with. You have not studied well, you have not prepared well, then you get anxious. That is totally different from having an anxiety disorder where we don't know, out of the blue, you feel anxious and worried and you find it very difficult to attend or face that particular anxiety provoking situation. I'll give you a small example. Many people have this difficulty in talking in public, or doing a seminar in front of other people, or doing a program on the stage. And if you are so anxious and not able to relax, you have a very difficult bodily changes at the time of doing that particular task. And if you try to avoid such situation, not on one occasion, but repeatedly, that could be because you are having an anxiety, which is termed as social anxiety, or it could be also a performance anxiety. So this is different from the common worries or anxieties which majority of us generally have. Then coming to the premenstrual dysphoric disorder. This is a particular condition only happening in women because they are only the group of people who undergo menarche. So in the premenstrual dysphoric disorder, for a person who has already started her menstrual cycles, the onset is usually before 1 to 2 weeks of each menstrual cycle, characterized by feeling very irritable, at times maybe feeling very sad, you cry for no reason, you feel anxious, you have difficulties in falling asleep or maintaining your sleep, inability to concentrate. These are the symptoms of a premenstrual dysphoric disorder. It usually subsides by the onset of the menstrual cycle. So it is just before the cycle, you feel irritable, you feel annoyed and angry. Some people report feeling sadness, some are anxious. So how to identify whether you are having a premenstrual dysphoric disorder? You should have these symptoms before every cycle. It is not happening only once. It will be there in just before every menstrual cycle. Then that is an indication that you may be undergoing the premenstrual dysphoric disorder. There is a lesser variant of the same, which is called as PMS, premenstrual symptoms. That is not severe as the premenstrual dysphoric disorder. Premenstrual symptoms, again, characterized by irritability, but of less variant. And sadness will be there, but you are able to manage and move ahead in your day-to-day activities. But in PMDD or premenstrual dysphoric disorder, people who are undergoing this may not be able to function normally in their day-to-day life. Then the next condition is postpartum depression. I don't know how many of you have heard about this. So postpartum means after delivery. So a common term which we have heard is postpartum blues. That is not a mental illness, because nearly 50 to 85% of new mothers experience this kind of postpartum blues. That is a difficulty to adjust with the new routines of having a newborn, sometimes characterized by anxiety about how to take care of this child, sometimes worries about the child, and inability to sleep and inability to enjoy day-to-day activities. So this postpartum blues usually subside within few days or maximum of a week's time. But postpartum depression is much severe form of postpartum illness, which is characterized by the depressive symptoms, which I have already mentioned in depressive disorders, and they have inability to take care of the child. The mothers who are having postpartum depression find it very difficult to take care of the child, and few of the mothers can be a threat to self and to the child. That means they find it very difficult, they get angry, they feel like killing their own children, and they at times feel very much sad and unable to settle themselves. So this may be a cause for many of the newspaper reports of mothers committing suicide or newly born children being killed by the mother. So this could be because few of this could be because of a postpartum depressive episode in the mother. So if we don't know this as a illness, there are high possibilities that the women doesn't seek help or doesn't get help, and they end up in trouble. And coming to the next life stage, that is the perimenopause. Perimenopause, what happens? That is immediately after the stoppage of menstrual cycle. Women report having trouble in sleeping peacefully, tend to be more irritable. They keep complaining of increased body heat, multiple aches and pains all over the body, again inability to concentrate, and lack of interest in sexual life. These are the characteristic features of perimenopausal dysphoric disorder. So being said that, when to seek help is the next question. For any kind of mental health issues, when to seek help is a question many of us have in our mind. People keep saying that these symptoms will subside. Why to go for a consultation? But there are few things which may not subside on its own. So when these conditions are adversely affecting your day-to-day life, it is an indication that you need help. If you are able to manage your day-to-day life with all these kind of symptoms, that is not a condition which needs treatment. Then the next question is whom to approach if you have a problem. So usually we have seen lots of people who are claiming to be professionals in the mental health field. You may be seeing lots of videos of counselors, people giving you advice, people giving you informations about how to handle a relationship or how to break a relationship, how to maintain balance, and lots of other informations. But it is always better to approach or seek help from a trained mental health professional. So for your information, mental health professionals are broadly of 4 different categories. One is the psychiatrist, whom you have heard of, then the clinical psychologists, psychiatric social workers, and psychiatric nurses. I'll briefly tell you the educational qualification of these people so that you won't go to an untrained professional. So a psychiatrist is a person who has completed his MBBS plus MD in psychiatric medicine or a DPM in psychiatric, diploma in psychiatric medicine, and who is practicing. So he should have a basic MBBS degree plus MD in psychiatry or diploma in psychiatric medicine. That is the one who is called as a psychiatrist. And the psychiatrist is the only person in the mental health professional who can prescribe a drug. All other professionals are not supposed to prescribe any kind of medications. Coming to the clinical psychologists, these are the people who have passed master's degree in psychology or clinical psychology and have undergone 2-year full-time master's Master of Philosophy in clinical psychology, that is MPhil in clinical psychology, and who has license to practice. They have a body called Rehabilitation Council of India who is providing licenses for them to practice. So if you are going or referring somebody to a clinical psychologist, just check if they have an RCI number. If they have an RCI number, that shows that they are a trained clinical psychologist. So the responsibility and duties of the clinical psychologist include doing the psychometric tests. For example, if you want to know how intelligent are you, what is your intelligence quotient or IQ, then you need to go to a clinical psychologist. Or if you want to know what is your personality type, these are the experts who will do an assessment on you and tell you what kind of a personality you have. And if you want to know which course suits you, you want to know your aptitude, clinical psychologists will help you in doing the aptitude tests. And the next category is psychiatric social workers who has master's degree in social work with medical and psychiatry as their specialization in masters, then 2-year full-time MPhil course in psychiatric social work. So these are the people who do psychotherapy and counseling practices. They involve with individuals, families, and the society in a totality. So a client is seen as part of a wider system, including the family and the society. And next category of people are psychiatric nurses who have finished either their ANM or GNM plus having a diploma in psychiatric nursing, that is a post-basic diploma in psychiatric nursing, or people with MSc in psychiatric nursing. So being said about all these professionals, most of you will be having another question in mind. Are these mental health issues curable? Have you ever had a doubt? Are they curable or not? To be giving you the information as simple as possible, mental health issues are of 2 types, which can be classified as major mental health issues and minor mental health issues. These major mental health issues are like having a diabetes or having a hypertension. So any of you having a diabetic condition or a hypertension, know that you have to take treatment or take medicines to bring it to your normal levels. And these medicines need to be continued throughout your life. Once your sugar level is on normal, if you stop taking medicines, there is high possibility that it will shoot up again. Or if you have balanced your blood pressure with medications, once you stop that, there is a possibility that it will show a variation, either too low to be normal or too high to be normal. So what happens? You need to take these medicines throughout your life. So in case of major mental illnesses, medications needs to be taken throughout the life of the client. But depending upon the symptom presentations, the psychiatrist will do assessments and taper or increase the dose of medications. it is not like the person who started on medication will be taking the same dose till the end of his life. There can be variations, and there can be a minimum dose of medicines which is required for certain people. So another question is, are we able to lead a normal life if you have a psychiatric illness? So I'll come to the example which I have given earlier. If you are a diabetic person, you are able to lead a normal life even with medications. Likewise, a person who is having a severe mental health issue can also be leading a normal life if taken treatment in the initial symptom presentation and continues taking treatment as per the advice of the doctors. So the second category of mental illnesses, which I said are minor variant, is like having a cold or a fever. When you have the illness, you take medicine. When the symptoms subside, you can stop the medicines. So some of the mental illnesses are not curable but are treatable, and some set of mental illnesses are completely curable. So what are the types of treatments available? Treatment is available in the form of medications, and then counseling and psychotherapy, that is non-pharmacological treatment. And another thing which you may be very familiar with is the ECT, or the electroconvulsive therapy, which you have might have seen in many movies in the wildest forms. But in current day practice, the electroconvulsive therapies are given under complete anesthesia, and the patient may not have any awareness of what is happening, and the entire procedure may take 4 to 5 minutes at the maximum. So electroconvulsive therapies are usually given to people if no medications are working properly, or if the symptoms are so severe that the patient is a threat to himself and to others, and there is no time for the medicines to act, then ECT is a preferable way of treatment. Or if the illness is happening in a pregnant woman whose medication can affect the child in the womb, then ECT is considered as the safest treatment modality. And what are the misconceptions about cause and treatment of mental illnesses? Can you please unmute and respond? What are the common misconceptions about mental illnesses? Can anyone please unmute and respond? May not be applicable for you, but you might have heard from people telling about that. Anyone want to respond? No. Out of the 29 participants, nobody wants to interact. That's actually sad. So how are you going to resolve your work and family life issues if you are not ready to talk? Okay, let's see. I'll move on under the impression that you don't have any misconceptions about the cause and treatment of mental illnesses. So now coming to the second part of the presentation, how to manage work and family. The basic question is, when are you stressed? Anyone in this group who doesn't feel stressed? I would say a minimum amount of stress is good to enhance our performance. If you are not at all stressed, you won't be studying for your exams, do you? But if you are too tensed or too stressed, it is again difficult for you to productively engage in any activities. So usually a person feels stressed when the demands on us exceeds our capacities or potentials. You are capable of doing a particular task, and if somebody is asking you, you don't feel stressed. You will be happy to do that. But when a demand is placed on you which you are not capable of, which is outside the capacities of yourself, then there is a possibility that you feel stressed. So with so many demands on our time, it's hard to please everyone. If working women are there in the group, they will find it that it is really difficult because the number of roles and the goals in life are totally mismatching. You want to be successful at your work, enjoy a healthy couple relationship, and be a good parent. You may have goals of furthering your education, maintaining a home, and be involved in contributing to the community, or keeping a fitness regime and saving for early retirement. If you have all these things in your mind, it is very difficult for you to not to feel pressurized. Further, you may be juggling extended family issues like caring for aging parents or dealing with an illness in the family. So, how to resolve such kind of issues? First rule is to set priorities. The best way to manage your work and family is to set priorities. For example, if being an involved parent is a priority for you, setting aside time each night to play with your children might take priority over working those overtime hours in order to finance a bigger home. And for students, if you want to excel in your academics, if that is the priority, then you should cut down the time taken for your extracurricular activities or the time you spend on social media. This is just an example. So you will have to set priorities in your life. Then rule 2 is to plan and do things in advance. For students, when you are preparing for an exam or when you are going to face an exam, you are well aware that these exams will be there. Like from the beginning of your course, you will be knowing that the exams will be there at the end of each academic year. So are we utilizing our time productively? If you're utilizing your time productively, then you don't have to worry about balancing your work and your personal life. Likewise, for a working woman, it is very difficult to do everything on a working day. So you have to plan ahead and on your holidays, think about how you are going to move in the coming week. So you may have to do prepare a what to do list and follow the same. Some working mothers say that it is easy for them to cook on weekends and store the food in the refrigerator for a quick reheat on a busy day. And you can also delegate responsibilities to others in family as well as at work. There are certain women who tend to do everything by themselves. And they may be the category of people who are perfectionists. So it is very difficult for them to let go of the responsibilities. Then it is highly possible that you will feel stressed by the end of the day or by the end of the month. So delegate responsibilities to others whenever possible, be it in the family or be it at your work. Rule 3 is to share your worries. See, when you think about the mental health conditions, unlike physical conditions, we don't have an accurate measure or an instrument to find out how stressed are you, how sad are you, or how worried are you. If you have fever, we can use the thermometer and measure your temperature. If you have hypertension, we can use and measure your how hypertensive are you. Then you can do blood tests to find out other vitals of yourself. But when coming to mental health or mental illness, there is no such instrument which can be inserted inside your body or which can take blood and decide whether you are mentally ill or whether you are sad or depressed or worried. The only way through which a therapist or an expert or a family member or a friend can make out what is there in your mind is only through your talk. So it is mandatory to share with others, share your worries. And if you're not sharing, you don't have the right to complain that other people are not able to understand me. If you openly tell them, openly inform other people, they will be able to support you and they will be able to understand you. And when you are too worried, rely on a partner or a close friend and then try to ventilate your emotions. So we generally say that the human mind is compared to a pressure cooker. You all might have been using pressure cooker on a day-to-day life. So we know that when the pressure inside the cooker is crossing a limit, it will, through the vent, it will release the pressure. So likewise, human mind has a limited capacity. When the pressure is extreme inside that, we need to vent the emotions through the process called as ventilation. You have to openly talk your emotions out to somebody. Or if you are not doing that, what will happen? If the valve or the whistle of the pressure cooker is not working, what will happen? The same thing will happen if you are not trying to release the pressure inside your mind. One fine morning, it will burst. And the bursting can cause destruction not only to the individual but to the surroundings. So it is always better to start talking and sharing your emotions or worries. Remember that you are not a machine but a human being. So it is okay to make errors. It is okay to feel exhausted and it is okay to feel tired. You are not a superhuman being or you are not a machine. You are a human being and it is possible that you may make mistakes. And rule 4 is limit after work involvements. This is not for students, this is for working women. So this shows that do things together as a family, like playing a game or going for a small ride. Learn to say no and let go of the guilt. Sometimes your superior may give you a job or a task after your working hours, and there are possibilities that he or she will pressurize you to complete the task within the stipulated time. And if you are sincerely worked during your working hours, you have the right to say no. That is just being assertive. That will reduce the overload on you or the pressure on you. And to enhance the quality of your family life, it is always good to have family rituals. These rituals are like having at least one meal together with all the family members, sharing some common day-to-day activities with the family members, celebrating festivals, or going for a pleasure trip. These are all family rituals which can enhance the well-being of the family as a unit. Rule 5 is take time for yourself. As a woman, I would say and agree that we have time for everybody else and for everything else, but not for ourselves. So we have to take time for ourselves, and that should also be a priority. It could be for a simple, pleasurable task of yours. You can continue a hobby which you have stopped in between. You can do an exercise which you would like to do. And these kind of things will enhance your mental health. So take time for yourself. It is very, very important. If you take care of yourself, you will be better able to take care of those who love you and deal with the stress that a busy schedule brings. So it is mandatory to take time for yourself. And rule 6 is make room for couples or for partners. For working women, if you are too stressed, too worried, don't have time for anything, and you somehow manage time for your kids and you forget about your partner, it is very, very important that you find time with your partner, because That is the primary bond in a family. The husband and wife, or that they share the primary bond in the family on which the other bonds are being built up. So if the base is very weak, high possibility that the entire system called family can have its repercussions. So set aside time for one another, go for a walk or do something which is pleasurable for both the couple. And if you are staying away from each other, make sure that you talk to each other and share the day's activities at least at the end of the day. And rule 7, learn to control your emotions. So anger, sadness, and guilt can cause interpersonal relationship issues at work. Learn to control these. It is not that easy to control your emotions, but you can master if you want. If you really want to control your emotions, there are ways to control it, or there are people to help you in identifying your emotions and teaching you to control your emotions. Share the positive emotions like happiness and excitement. You can try to control or learn to control the negative emotions, and at the same time, you try to share positive emotions like happiness and excitement with others. Celebrate events together, be it at family or at workplace, and acknowledge the goodness in others, which is very, very difficult for most of us, but you can learn to acknowledge the goodness in others and be thankful. Thank you all. With that, I'll stop my presentation, and the forum is now open for your questions or comments. Thank you.
Yeah, participants can pose queries, if any, in the chat box.
You can also share your experiences.
Yeah.
Hello, ma'am.
Yes.
Thank you, ma'am, for your session. I have a query. Most often, what we see is working women are handling many positions in the at home, at their office, etc. And along with that, when we get involved in multiple activities, at some point of time, we get really frustrated with everyone. And often in my case, what happens is I show all sort of frustrations at my house. Mostly my kids suffer from that.
That usually happens. Everybody keeps saying that. Family is the place where we take out all our negative emotions. So how to handle? That is the question.
Yeah. How to handle? Plus, along with that, when at our workplace, when we get involved in all things and when we get involved sincerely, what happens is there will be some sort of barriers from all sides, restraining women, especially there will be some sort of barrier for women. Do you have any suggestions?
For the second part of the question, I don't have any suggestions. But that should be the attitude of other people around you should change. Then only that kind of problems can be changed. But balancing the pressure at work, it is maybe because you are taking up too many responsibilities. And as I told, when you know your capacities and when the demands on you exceeds the capacities, then it is the time that you feel stressed. So once you recognize through one experience, if you understand that I can't take up so much of responsibilities, you should be able to say a firm no. That is the major difficulty many women tend to have. We are not assertive. We tend to take in all work, even if we have to compromise our personal time. Right. So if you want to lead a healthy life, You should be guilt-free. Like, I have said no because this is my special time with my kids, or this is the special time I should be spending with my partner. So it is okay to say no. See, if we are not doing it, somebody else will surely take it up. Right. But we have a feeling that if I don't take it up, things are going to be a mess. That is just a subjective feeling. If you are not there, somebody else will be definitely there to take it up. So it is little difficult, but you will learn over a period of time. Hope I have answered.
Yes, yes.
There is a question posted in the chat box. Does mental illness get worse with age? Is age a factor? Not exactly. It doesn't have a correlation between age and the severity of mental illness. But what happens is all kind of mental illnesses will respond well if identified at an earlier point of time and treated. Like most of the mental illnesses, like major mental illnesses, start with early adulthood. Around 18 to 25 years is the onset time for many of the major mental health issues. If people are not able to identify it in its onset, there is a possibility that as the age progresses, the symptoms becomes more severe and the person becomes very difficult to manage. So it is not the correlation between the age and the worsening of symptoms. It is because the symptoms were there even before, but it was not properly identified and treated. In that case, it can get worsened as the person is getting older. That is, the illness has become more severe and it is not being treated in the initial days. So that is the factor, not an age factor. And mental illnesses need no, it doesn't have any caste, creed, religion, gender, or age boundaries. We have a misconception that children are safe. They don't have mental health issues. It's a wrong notion. Even very small child as of 3 years of age can have mood disorders. They can have schizophrenia, kind of major mental illnesses. They can have depressive features. They can have anxiety features. But the presentation may be slightly different from that of being seen in an adult. So no one is free from mental health issues. A person who is very normal today can be abnormal tomorrow. Is it possible to figure out the mental illness easily if someone has any? Okay. See, as I told you, the mental illnesses usually affect our thoughts. And thoughts are being identified through the way we talk. Right. What is there in my mind, you will know only if I openly talk. And any kind of mental illnesses can be identified through talking. If you are skillful, you can make out that there is some problem with the person who is talking to me. As I told you, there are two different categories of mental illnesses. One is major mental illnesses and minor mental illnesses. In case of minor mental illnesses, the person who is suffering will have insight. They know that there is something wrong with me. People with anxiety disorders will say that I feel anxious, I feel worried. So in minor mental illnesses or less severe form of mental illnesses, the person himself or herself can identify that I have a problem and I need treatment. But unlike in minor mental illnesses, people with major mental illness does not have the insight. So they find it very difficult to understand that they have a problem. They are under the impression that they are perfectly all right. But all other people know that there is something wrong somewhere. So a person who is having severe mental illness can have difficulties in the way they communicate. they don't have connections between what they said previously and what they are telling now. And they have difficulties in organizing their thoughts and talk. So what happens, they will start off with one point and then derail from that and reach at something else. So if you listen to that for 5 to 10 minutes, you will be able to make out that there is something wrong. And these people can have perceptual abnormalities. Perceptual abnormalities in the sense, you might have heard of hallucinations and delusions. Hallucinations are sensory stimulations or sensory feelings without a proper stimuli. People with hallucinations can hear voice of others, which is actually not there. And people can be suspicious of other people and they feel that others are talking about me. They are trying to kill me. They are trying to mix poison in my food. So these kind of characters or features can be very evident in a mentally unhealthy person's speech, thoughts, and behavior. So if you try to analyze the person, or if you interact with that person for 5 to 10 minutes, normally you will be able to find out that there is some problem somewhere, but you may not be able to fix where the problem is exactly lying and what to do. So for that are the people who are called the mental health professionals. If you find somebody who very close to you and having all these difficulties, you can refer them to a mental health expert. So I'll move on to next query. There are students who become evasive and doesn't open up neither to their teachers, parents, nor to the counselors. How can we convince them to open up so that their problem can be addressed? There is no way to convince somebody to open up. It's up to them whether they want to talk out or not. We can't help a person who doesn't want to receive the help, especially for counseling and other things. The person has to cooperate. Without the cooperation of the patient, you will not be able to do anything. There is no point in talking to them, but you can just motivate them to seek help. For example, the families can say that we find certain things different in you which are not there in other siblings. So we are worried. Would you like to take help? Would you like to get it clarified? If you label somebody as having a mental health difficulty and drag them to treatment, it may not work. A good counselor or a teacher or a parent can motivate these people to take help. Okay, I think those are the queries posted in the chat box. Anything else? And as somebody has already asked, the best way to identify a person having mental health issues is they will have difficulties in their sleep and appetite. The basic biological functions tend to be affected in a person who has unstable mental makeup. For example, just imagine if you are worried about something, will you be getting adequate sleep? Most probably no. Will you be able to eat properly when you are very sad? No. So your basic biological functions tend to indicate that you have some problem. It need not always be a mental health problem. Certain physical illnesses can also present with similar kind of symptoms, but most of the mental health issues will start with difficulties in sleep and appetite. Okay.
Okay, thank you, ma'am, for your wonderful session. On behalf of IEEE Malabar Subsection, I thank you for this, for spending some time with us. Really, it was an interesting session.